So when you look at the before and after, by the way, when she sees herself for the first time, is it emotional? Can it be emotional for somebody like that?
Yes. These patients, sometimes they break down crying. I mean, that's the difference. They've been suffering so long and not really knowing what to expect, or, you know, and they're really thankful that it didn't hurt. You know, these patients, they're not going to be taking all this pain medicine. It's worse getting your wisdom teeth out than getting a full mouth of
So it's like having your
implants.
teeth back, by the way.
Absolutely.
Right? I mean, it feels like
it feels
your teeth
real.
are- Okay.
They tell me that they haven't had that sensation of chewing and swallowing since they had teeth.
Is this one of those things where a patient might say, you know, I should have done this years ago?
Absolutely.
Do you hear that?
Yeah, they're shocked and amazed that they hadn't done it before, and they're sorry all the wasted years that they spent suffering with these dentures.
Now, on the phone, you know, we talked that if there were a try-in period, somehow, I guess there's not, you know, like on a Friday they come in, they try it for the weekend, that they couldn't go back, that every single denture wearer in Texas would do this if they knew
Oh, absolutely.
the benefits.
There's no question. There's no question. You can never go back. It's the difference between, I don't know what to say. I mean, chewing and not chewing. They're not really chewing when they're having the dentures in.
Okay, okay. Now, what is that? That doesn't look too good right there.
Well, this is one of those wonderful cases.
That's a bad one.
You might think that this is something unusual.
It's got to be rare.
It's not rare. It's an everyday thing. And it's not that these people don't care about themselves necessarily, or, you know, that they, you know, didn't think about it.
Just one tooth on the top.
Yeah, well, there's more than one. They don't look like teeth anymore. I mean, those are what we call things formerly known as teeth. But
That's okay.
but basically, this is a gentleman that had a partial denture in for many years, and the teeth kept rotting and breaking off. Didn't have insurance for a long time, so he just suffered with it. He was actually holding his partial up with his tongue when he came in. So he come to see me and said, well, Doc, my dentist says I need another tooth out. So that's what he was doing. All of his life, he kept bending down and not talking. He certainly didn't smile. I mean, would you smile if you had that in front of you? No. So he was extremely self-conscious, very fidgety. And
So what did you do for him?
So I told him, look, I don't think you need one tooth out. I think you need them all out.
So those teeth had to go.
These teeth definitely have to go. There wasn't any option. And he thought about it for a little while. And in the 1 week and he was thinking about it, another one broke off, and he called me back and said, you know, Doc, you were just so right. I'm ready to go.
All right.
So he came in. We took the teeth out. He got 4 implants on the top and fixed prosthesis again. We screwed it in. And he wanted to start out with that at first. I said, okay, we can do that.
So a denture on the lower and then just something...
No, he kept the bottom teeth. He wasn't ready to let everything go. This is a very cautious fella. He was very OCD, computer-type guy, and he just wanted to make sure that he knew what he was getting into. So he came back in and got the 4 implants on the bottom, took the teeth out, and the implants went in the same time. You know, back in the day, it used to be you had to take the teeth out and you had to...